It's 6:32 Eastern, so I think we will begin. Thank you everyone for joining this evening on the East Coast, this afternoon on the West Coast. We're super excited about this. I'm Isaac. I am the marketing director at DSN. I'm new, started a few months ago, and this is the first webinar I've been a part of, so super excited about that. Relatedly, if there are any technical difficulties, please be patient with us. Like I said, this is our first webinar, so we'll do our best. Any questions you have, you should be able to ask a question. I know someone just did, and I was able to see it, so we're off to a good start. Yeah, like I said, we'll send this around, so super excited. Last point is, I know we have some customers attending and some non-customers attending. We did our best to make this as valuable as possible for sort of both segments of people. If you have any questions or want to see any part of the software we show after the fact, we're happy to do that as well. So with that being said, let's hop in to unlocking the power of automation in your practice. So a quick agenda. I guess I just did the introduction, and I'll introduce Holly in just a moment. But today we're going to talk about clinical automation and show a demo of that and how we help practices automate the clinical portion of their work. Same thing with billing, same thing with administration, and then we'll get to some questions at the end. If you have questions during the session, feel free to put them in the chat. It's possible we wait until the end, but we'll sort of play that by ear. This session is scheduled for an hour, but we'll do our best to get through most of it quickly so we can save time at the end for questions. So now to introduce Holly, she is the Director of Training and Project Management at DSN. She has a long history in the IT world, and she brings 5 years of hands-on experience from a general dentist practice, where she developed a deep understanding of patient care and how teams can use software to streamline their workflows. She joined DSN a couple of years ago, where she now leads the training department and manages projects to ensure that every practice receives a seamless onboarding and effective training. So super excited to have Holly on board, and I think you folks will all learn a lot from her. So just to give you a quick outline of why we decided to focus on automation and the problem of productivity in dental practices. These are some stats we found, but high level administrative tasks account for approximately 49% of a physician's workday, which is time they're not spending on patient care or growing their practice. 70% of physicians report spending 10 or more hours per week on admin tasks. Admin burdens are typically the main contributor to physician burnout. You can find a million of these stats. We just handpicked a few of them, but I think we all sort of understand that, which is why we're here. So in terms of why does automation matter and why is it so important to your practice? One is efficiency. With automation, you can take tasks that typically take hours and do them in minutes or seconds. Accuracy, the more you can automate sort of intelligently, the more accurate you'll be, the less errors you'll have. And that sort of relates to compliance. The less errors you have, the more compliant you'll be. If something comes up, you'll have rules in place to make sure that nothing sort of out of the ordinary, out of the workflow was complete. And lastly, focus. We only have a certain amount of focus power, and the less we need to focus on those monotonous tasks, the more we can automate, the more we can focus on that high level work of treating patients and growing your practice. So Holly, I think it's your turn to take over. Yes.
Yes. Hello. Thank you, Isaac, for the introduction and kicking off our webinar. I want to thank everyone for their time this evening, this afternoon to join us and discuss more about practice automation. I hope you're able to take a few of these points back to your practice and hopefully implement them or be able to build upon them. So we'll go ahead and start talking about clinical automation. There are a few different features that we've chosen to talk about today that could help automate your clinical workflow. The first one is going to be pre-built note templates, allowing you to easily create clinical notes within minutes. It brings over the bulk and the content of that clinical note, and then you can amend and change information as needed. Another area that we can pull into our clinical notes would be real-time vitals monitoring, meaning that it's pulling in the vitals readings from the machines directly into your op or surgery report. It's time stamping it however often you need that to pull in, so that you don't have somebody who's having to manually sit there and take note of that. Another area that is easily to help with efficiency in creating treatment plans is going to be bursting procedure codes. This is a concept that bundles commonly used codes together for procedures. For an example, if you're a general dental practice and you're scheduling out prophy appointments, you could add your prophy code, your radiographic codes in there, and then your periodic exam. If you're a oral surgery practice, you could create one for wisdom teeth removal, have all your extraction codes in there, your sedation codes, and any therapeutic drugs you also administer. Similar to the bursting codes, we also have something called bursting prescriptions, which help you automate prescriptions and sending them out electronically. What that does is the same concept of bundling together commonly used and commonly prescribed prescriptions together in one fell swoop. So you grab that prescription name that you've created for a procedure and it pulls in 3 to 4 or 5, however many different prescriptions you have for that type of a procedure. And then lastly, we have referring doctor's notes. This helps you automatically or auto-generate letters that can go out to referrals to let the patient, not the patients, but also patients and the provider know where the treatment, the prognosis on the treatment, how it went, and if they're ready for the next steps. So we'll go ahead and show a demo of this from our DSN Cloud product. If you are one of our current clients, this may be familiar to you, or you may be on our V20, V30 software. The features I'm showing today are available in both systems or all 3 systems, so rest assured you do have availability to implement these. So we'll go ahead and talk about our EMR notes or our pre-built note templates. In our system right now, I am looking at what we would call the consult note. So it's your history and exam. So your history of why the patient's coming in. Let's say that this is a patient coming in for a consult of extractions of wisdom teeth. I have pre-customized and built out note templates that I can apply. What that's going to do is when I hit apply, it's automatically going to populate each section with information I have saved. I can come in here and I can amend as I need to. Let's say that we know that this patient does not have their lower wisdom teeth. I can remove that area right here, or I can do that in one other place. I can come into the limited exam portion. So this is going to be your intra and extra oral exam, your radiographic findings, and I can hit thirds template, apply that, and see how it auto-populates the information. To review this all at once and to make final edits, I can come over to my review and finalize window. And hit save. And again, we apologize, we are in a test system, so sometimes it does not work efficiently as if we were in a live system. Give me 1 second to try to refresh. I'm going to actually close out of this window and let's see if when I bring it back up, if it populates.
This was going just too smoothly. Something had to pop up.
There we go. So here we go. Here is our history and exam note here. And I have here, you see that it's all formatted for me. It brings in all the different sections that I filled out or that was pre-populated from our note template. And then I can even come in, if I were the provider in the room, I could say, let me take a look at that note real quick before I walk out. Give it a second to populate. I can come in here and make those edits I need to. This is another area you can edit. So I said earlier that he didn't have this lower wisdom teeth, so I can remove that area in each of the different sections. So I could save that. And then I can also sign my note before I even walk out of the operatory. Or I can go back to an office and complete filling this out, making edits, hit save. I'm not a doctor signed in, but if I were, that's how you would sign it. And you're good to go. You're not having to come in later in the evening. Remember what you did for that patient, what you discussed, and then try to either dictate notes or write those out. So it can be done on the spot within 5 minutes. The clinical notes can be created prior to the appointment or before you seat the patient in the chair and bring them back, especially for your commonly used procedures that you see most often. So that's how we can create our EMR clinical notes from preloaded note templates. The same thing would apply with our vitals monitor. We would have an area in our surgery note that would pull in that information with timestamps. I'll go in to show you how our bursting procedure
Right.
codes are bundled
Holly,
together. Oh,
really quick, 2 quick questions for you. Is this only for the cloud version of DSN?
no, this is also available in B20 and B30 and all of our B30 entities, whether it's multi-exec, perio, endo, or oral surgery or general dentistry.
Perfect. And then, so those templates, are they customizable? Does DSN come with some built out? How does that work?
So we have about 2 or 3 that are built out just to show examples, but they are very customizable. We've seen offices customize them per doctor, per location, per practice, very easy to customize. What I recommend is if you have a note template or format that you like, if you have that written down somewhere or typed out, you could have that window open to create it and just copy and paste that information over. And then if you want to leave areas where somebody needs to come in and fill something out, you could put a question mark or a line underneath so that it's an indicator of, hey, this is something I need to fill out.
Got it. Perfect.
All right. I'll show now the bursting procedure codes and how that can easily help you create treatment plans quickly and efficiently and with more accuracy. So our bursting codes are also customizable as well. You can create those based on procedure and bundle in the most commonly used procedure codes that you would use. So I'm going to use one for thirds. I have a treatment plan that I have pulled up right here. I'm going to add, I need thirds. So when I hit tab, it pulls in those 4 extraction codes, the sedation, and then I can come in here and change this if I needed to. So if these were not completely bony or full bony impacted, I can come in here and put partially bony. If they don't have lower wisdom teeth, I could delete that out. So again, the bursting procedure codes are a guide to help you create the treatment plan. It saves time on your staff coming in and looking for each individual code and having to find that and apply it to your treatment plan. If I need to add anything here, I can also do that as well. So if I wanted to add a therapeutic drug in here, let me see if I can type correctly. And then I have my treatment plan created. You can also create these bursting procedure codes if you have like a phased out or staged out type of a treatment plan that you need. You could add all of that into one bursting procedure code, and then you would be able to come in and easily apply phases if needed under this phasing section right here. It just makes it a lot easier to bring everything over at once instead of individually.
Holly, we are getting a question
Okay.
about ICD-10 codes.
Yes, so those can be applied if you are needing to send off diagnosis codes. You can apply those at the very beginning before you start treatment planning, or you can apply those at the very beginning before you actually charge out the patient. Either way, As long as it's applied before you start, it will apply to each line item. And I'll show you that in a later example of how we can apply those diagnosis codes, and it'll apply to each line item.
Thank you.
And then lastly, we'll go into the prescriptions and how those bundles work as well. I'll come into prescription. You'll see that I have in my library of prescriptions, I have these bursting prescription codes, and then I have my prescription standalone here. So if I wanted to use a bursting prescription code, I could come in here and say, I want to use the thirds. So I can come in and select thirds, and that's going to bring in all 4 of my bundled prescriptions together, rather than having someone have to come over here and select each individual prescription that's needed. Your clinical staff is already doing a lot between, generating consent forms, getting those signed, making sure the notes completed or information's in there correctly, adding pharmacies sometimes to the system. So this is just one less stress that they have to worry about. It also includes the dosage here, so that is always the same if inconsistent, or you have the availability to change it per patient once you have it loaded up. Do we have any questions on prescriptions?
None right now, so I think we are good to keep going.
Perfect. All right. So lastly, we'll talk about how you can create your referred by letters or your thank you letters to your referrals, and then also how you can also generate from the system consent forms for the patients to sign. So you're not having to add in and write in the patient's information. You can come in and create that. We have categories of, you can either customize these or some of these are preloaded for you. And I could do a tooth extraction consent form. See how it brings in my patient's name right here. This actually, the diagnosis and procedure is actually pulling in from our clinical note here. If I come to the history and exam, it pulls in from the plan area and the diagnosis section here. And then if I need to, I can also edit this and add more information. So if their alternative is watch or none, you can add that. You can select the type of anesthesia they will receive. If it's sedation. And then if you do have the digital signature pads, you could have them sign that in office. And then it would be saved in your system digitally. If not, you could always print this out and then scan it back into your system. So that's how our consent form can be generated. It cuts down on time having to grab another paper, print it off from another place, and put the information for the patient. And then we can also come in and print out our referred by letter to tell them thank you and let them know what was done for that procedure of the day.
Awesome. So quick question coming in. Are bursting codes and prescriptions available for V30 as well?
Yes, they are. Yes.
Perfect. Thank you.
So I'm going to come in here and generate our treatment letter. You'll see that it pulls in the date that we created this letter. You can put a letterhead up here if you need to, or image, logo. We have our referral information that's pulling in from another portion of our software. We have the patient's name, who the referring doctor is, when they were seen. And then you can come in here. If the treatment isn't already added on this letter, you could come in here and write this information. Section of hit save. I can either print that out, or we do have the availability to email out of our system. However, my email is not hooked up to the system right now, so I'm not able to show you that feature. But that is also available in both V20, V30, and cloud. These notes that are in here, this letter template, and also your consent forms, Those can all be customized. You can take out information that you need to. You could build these from scratch if you wanted to, and you can add in areas where you can pull in other information from the system. For like patient demographics, referrals, information, treatment plans, in-plan information, that can all be presented and created on a letter. So those are just a few ways that you can utilize your practice management software to help with automation in your clinical workflow. Do we have any other questions, Isaac?
No, we are good for now. There was someone who asked, a V30 customer who said the screen looks different. Yeah, this is the cloud version, but the functionality should all be the same. Things are just located in slightly different places.
Yes, that's correct. The UI is different from user interface is a little bit different, but it is all still available in V30.
Yeah, and
So
then
oh, go ahead,
no,
sorry.
sorry, no, I was gonna say, we're good to move on. We don't have any more questions.
Okay, wonderful. We're going to move on to billing now. So usually manual billing goes where you have the patient, you have them bring in their subscriber information, you input that into the system, you charge them out for your services rendered, and then you send off your medical claims or dental claims. But sometimes it comes back and it says if you're maybe a periodontist or an oral surgeon saying, hey, we actually need you to send us off to medical first before we can actually pay anything or say anything based on the dental codes. So then you have to come back into the system, recreate a medical claim to go out, and then wait for that medical claim to either be paid or denied. So it's just a cycle that continues to go and go and go. So with some of the automation with billing, it's more about utilizing your system, its features, and the reports and some of the integrations to build out a more robust workflow so you understand where your billing is and your claims are. So some of the ways that we're able to do that is patient data auto integrated, meaning once we have subscriber information in our system, we're able to use our sister integration with Dental Exchange and check on real-time eligibility. So we're able to confirm eligibility quickly and understand that they do have coverage and understand that what the information that they provided us is correct. That helps with admin tasks of input of subscriber information. Some systems allow you to add cross-coding, so you're able to file both for medical and dental claims at the same time because you do have medical codes and dental codes in your system. Once the patient is charged out for their services rendered, some systems will ask you if you want to create the claim, others will automatically create the claims for you and have them batched and ready to go when you send them electronically. Systems will also have checks to make sure that you have all the information that's necessary to send out the claim, whether it be subscriber information, diagnosis codes, and information that's needed to process the claim. Once you submit those claims, then you can come up with a workflow of how you're going to check on those claims and where the status is. You can either go into your insurance payer companies and look up those claims individually. You could do that through a clearinghouse to see where those claims are, if they've been submitted, processed, paid, or denied. And you can usually do that anywhere from 24 to 48 hours after you've submitted claims. This allows you to go ahead and resubmit claims if you need to. If you know that there's something's missing and it's going to be denied, you can go ahead and follow up quickly on that and not wait until it comes back with the EOB. And this helps with timely reimbursement and payment and just follow up on insurance. So we'll go into the system and show you some of those features of how in DSN we can use our features to help with automation.
Quickly, Holly, a few questions. One, someone asked if eligibility and claim status are coming back.
Real-time eligibility should be available in cloud currently. I believe it was being worked on in V30. We are still currently working on claim status, but if you do use Dental Exchange, they have a great way to go into the portal and check claim status, as well as eligibility too. But those are integrations we are currently working on to bring those back in. Thank you guys for your patience as we've worked through the challenges of the Change Healthcare crisis.
All right, a few more questions. Will Dental Exchange be 100% integrated with DSN? I don't know, Holly, if that's a question you'd know, or we'd have to go back and figure out.
The areas that we will have integrations would be the same integrations that we worked with previously with Change Healthcare, which is batch claim, electronic processing of those, real-time eligibility, and claim status. Dental Exchange does offer other services though from their side that you could always follow up with them. I know that they have an attachment service through on their portal side, as well as ERA.
Awesome. A couple of quick questions that are a little bit more specific. Let's hold off on these. There was a question about maximum dollar value for a claim in the new version. Yeah, let's hold off on that. Whoever asked that, I'm happy to find out for you. I just want to be conscious of time.
Okay,
Okay. Sorry, Ollie.
that's okay. So someone had asked earlier about ICD-10 codes and how those can be applied. I'm going to show you one way that they can be applied here. So we have an area in both our add transaction window when we're about to charge out the patient and our treatment plan window where we can add those ICD-10 or diagnosis codes. I'm going to come up to my upper left-hand corner under patient diagnosis. And let's say this is for a wisdom tooth. So I can go ahead and add that as a K00. Maybe it's disturbances of tooth formation or developmental and poor eruption prognosis. I can add both of those in. It's going to say this at the top. And then when I come in to add my charges for services rendered, I can again use my bursting codes if I want to. And that will pull in all of my bursting codes. I do have my cross code turned on. So it is going to cross code each of those dental codes to a medical code. And then in addition, it's going to also add the ICD-10 or diagnosis codes to each line item on my medical claim. Once I charge this out, so the patient's been charged out now. Now, if I come to view claims, I see that this patient has both dental insurance that's listed up in the top upper left-hand corner. And we also have medical insurance listed up in the upper right-hand corner. And I have the creation of both claims waiting to go out. In addition to being able to queue up both claims at the same time, under our patient information where we have our subscriber information for insurance, I can select how I want this billed out. Do I want dental first? Do I want medical first? Or can I send them both out at the same time? So those are two areas. So these two claims, medical and dental, will both be submitted at the same time. So now I'm ready. I'm towards the end of my day, or maybe it's the next morning. I've checked over each of my claims here. I know that they look correct. I'm ready to send those out. I can come into my insurance claim window, see my batch that's ready to go out. I can also see anything that is going to cause a rejection right now. And I can see why there would be a rejection. So this is missing a subscriber member ID. Maybe that was overlooked when we were inputting the information. The account, the information, the address for the patient is missing here. And then this is missing the referring NPI for that medical claim. So once I have all of my items on the claims corrected, I'm ready to come into set up. And then I can submit all these claims, either paper, electronic, all dental and all medical. Once the claims are submitted, either paper or electronic, I can come in and see what has gone out. I can look at my claim submission report, and I can base that on date range to help me keep track of what has gone out. And then I can go ahead and follow up on those claims in 24 to 48 hours, either through the dental exchange portal, the insurance payer portals, or in the future with DSN through the claim status. In addition to having these reports under our reporting here, and I'll get a little bit more into this a little bit later, we do have quite a few insurance report. You can run an insurance aging report. You can run an unpaid claims report. You can filter those by insurance company. So if you want to call in a bunch of insurance claims all at the same time to one company, you're able to sort your reports that way as well.
Holly, there are a few questions. Someone asked, will you be able to tell if we're in-network providers and what fee schedule they have us under?
For the practice themselves,
Yes.
so in the system, we wouldn't be able to give you that information, but once you obtain that information from that insurance company to know if you are a network and what your fee schedule is, we can load that fee schedule into the system. And I'll talk about that in a little bit later, how those fee schedules can help. Having those fee schedules in the system can help you calculate an estimate plan for the patient.
Got it. So like once you set it up once, it's sort of in there moving forward.
Yes.
Got it. And then another quick question. Is there a section where we can quickly look up a payer ID? And the
So payer IDs, oh,
tab.
I'm sorry,
Sorry,
in the insurance tab.
Yeah.
That's actually probably, if you're in V30, V20, that's going to be in your insurance tab up in your list up at the top. If you're in cloud, it's going to be under admin, edit lookups, and then your insurance. And there should be electronic NVA payer IDs and electronic payers. This is where it's going to have listed all of the payers. Maybe an insurance company has been added to dental exchange in their partnership. They would need to come in and they could add that manually here, and then it's in their system.
Awesome. Thank you. And then one more, sorry to interrupt your flow.
That's okay.
Someone commented the dental exchange eligibility tool, and sort of asking when it will be up on DSN V30, if you're familiar, Holly.
Let me just double check on that and be sure. It should be in the next build that comes out.
Awesome. And yeah, once again, any questions, comments we don't get to, happy to answer them after the webinar as well. All right, Holly, we're good. Sorry to
No, that's fine. That concludes my portion for the automated billing portion, and now we'll go on to admin automation. So with admin automation, there's a few different features that help optimize your scheduling, patient engagement, also being able to give patients accurate fee estimates for payment or what their responsibility would be for a treatment, and then also reporting to help practices make informed decisions for themselves. So we'll go into some of the ways that you can optimize your schedule. A lot of practice management systems have different ways to do that, either appointment templates, scheduling templates, ways to block off your columns so you can show your admin staff how and where to schedule. So I'll go ahead and show a few of those features that we have from DSN. If I come over and take a look at my schedule here, what you'll notice is that I have lighter blocks here. That these are what we call ideal days. This is what we would like to see typically on an ideal day scheduled out. This is going to help us maximize our production, also help us with our workflow through the office throughout the day, and then also provide an area and bird's eye view of, we have an emergency coming up. Where could we put them in? This helps optimize your scheduling and provides a guide. In addition to having ideal days set up where you can kind of guide your admin and clinical staff of where you would like appointments scheduled, you can also use something called appointment templates that are also customizable. What the appointment templates allow you to do is select one of the templates, bring it over to the scheduler itself. And these templates already have the amount of time that the appointment should be, the type of appointment that it is, or the color of the appointment, and any type of appointment notes that are there to help guide the scheduler for the information that it needs. So this already says a thirds consult. So when you take a look at the schedule, it'll let you know this is a consult for a thirds. Same with if I were to bring over an implant appointment template. I can slide that over onto my area where I see implant for ideal days, release that, and then on my messages, it's already pre-built in with what site is this going to be for the implant. You see that it's already saved for 60 minutes. I can push OK, and it's easy to schedule. You're not having to ask a lot of questions of where's the best fit for this, where should this go, how long should this appointment be? This will help optimize scheduling, make it easier for your staff, and also help maximize production. So once you have the patient scheduled out, you are able to send out automatic text to them. Those are also customizable per type of service. So for the color of the appointment, you can customize that. You can set specific dates that you want those messages to go out. So if you want to send out a message a week before their appointment, just to let them know, hey, friendly reminder, we have you scheduled for Tuesday, December the 10th at 8 a.m. And then 4 days later, or 4 days to the appointment, you want to send out another message asking them to actually confirm the appointment. That would go out once they replied with a specific C or Y that they will make their appointment. Then our indicator up here in the upper right-hand corner would change from either an unconfirmed U or a T to a green C to let you know where the status of that confirmation is. Then let's say that you do have another reminder going out to all patients one day prior to their appointment. You can customize that based on the color or your type of service. So for the sedation one, you could say, hey, friendly reminder, we have you scheduled tomorrow at 8 a.m. Please remember to follow all pre-operative instructions. Arrive 20 minutes before your appointment, have a driver with you, and please do not eat 8 hours prior to your appointment. For your consult appointment, that might look a little bit different. On that one-day reminder, you may say something like, we're happy to see you and meet you. Please arrive 15 minutes prior to your appointment and go online and fill out the patient paperwork. And you could add a link in there. In addition to being able to send out and customize auto confirmation text, you can also two-way text in our system where you can send out an individual text to the patient and they could come back in and return the text as well. So anywhere that you, in the system that you have a cell phone, that means you are able to text out. And then lastly, do we have any questions, Isaac, or?
Yes, a few questions.
Okay.
Someone asked, is there a feature that will automatically show when a first available appointment is instead of searching day by day?
We do under each of our locations for our scheduler. If I come over here and I'm in my main office and I come to scheduling, I can hit search and then I can give it an ideal day if you have those set up. So if I'm looking for a thirds consult area, I could look for that. Or if I'm looking for a post-op appointment, I can search by which columns I want to look for, how long that appointment should be. If I want to say this is going to be a 30-minute appointment, I could say if for preference AM or PM and what their range is to look for an appointment. I hit search. It's going to display any appointment that I have available, matching this criteria.
Awesome.
And then I can simply hit add and schedule.
And that's shown in order of first available, it looks like.
Correct.
Perfect. Another question, is there any way to stop certain appointments or issue a warning? For example, if a doctor has a preference on what his or her schedule is alongside something else, can the system stop the scheduler or warn them?
If you have your system blocked out for the specific dates that they do not want to schedule, it's going to give you a warning, hey, you're overriding a block. Do you want to do that? Or if you're scheduling on top of something, an ideal day, it would say, this does not match the ideal day. Would you like to continue in scheduling?
Got it. So it sounds like it is possible. It just takes obviously some work on the front end to set up.
Yes, yeah.
Perfect. All right. A few more questions that came through. Will you have an app like Flex to text with the patient from your phone? Holly, I don't know if you're able to answer that. I know I am not.
I would have to look into development with that. That might be something that is on our radar, but maybe not right now.
Yeah, happy to follow up there. And someone asked, does DSN V30 have an appointment time search? Or something similar to that.
In V30, there may not be an appointment time search necessarily. We do have the same search by appointment that allows you to pull in this information here. It does give you the length of time that you could search for. There is a function where you can see week view, which would present every single day up to 5 days with the number of columns with the times next to it. So you could kind of see if there was a slot of time that was available.
Got it. A few more questions are popping up. This is great. So thank you for all the questions. Someone asks, can we log on our phone to see patient demographics and EMR items?
In V30, the best, you wouldn't be able to see everything, but if you had that patient populating onto the evening call list from the iPhone app, you might be able to see certain specifics like allergies, medications for that patient and what procedures they had done. You wouldn't be able to see the full EMR note or clinical note.
Awesome. Another question, this was back in the billing section that I missed. Someone asked, are we able to attach supporting documentation for medical claims using Fast Attach?
Unfortunately, no. In order to attach anything for medical claims, you're probably going to have to go to that insurance payer's website and input that in a specific area they have. Or mail it off.
Got it. Couple more questions for right now, and then Holly, I'll let you keep going. Someone asked, can you check a schedule from your phone?
Not at this time.
Yeah, but that is good feedback. And then, sorry, last question, and then I will stop.
That's fine.
Are we able to send medical claims electronically with V30?
That has just been released. An email went out, I think, last week to register with Optum to do that.
Awesome. All right, that was it for the questions for right now. Thank you, Holly.
Okay, we'll go ahead and look into treatment planning and being able to provide a treatment plan estimate with a breakdown of benefits and estimation of payment for patient. If the patient, we have patients' benefits saved in our system, and if we have the correct fee schedules and insurance information tied to them. So I'll show you how we can save benefits in our system first. So there are two ways that we're able to save benefits in our NDSN. If I come into admin, if I come in, I can show you a treatment and insurance plan. So this is a policy that we've created based on an employer that we have in our system. And they are part of a network with Delta Dental of Minnesota. We know that they're in network because we have special billing of in-network. This is going to tell our system how to calculate and which fee schedule to use. And then we can also tie the fee schedule that we'd like to calculate our benefits off of into that insurance plan, along with the policies breakdown of the coverage classes and the maximum allowed for that. From there, we can also input benefits for a patient under insurance and patient insurance benefits here. That's where we can override some of the information from the plan and get more detailed or granular for the patient, determining how much insurance is already paid for their policy so far. Maybe they have a rollover of $500, so their max is a little bit higher than the actual policy plan that's available. So all that information helps when we're calculating that and calculating the treatment plan estimate. So if I come back into my transaction window and pull up the treatment plan that we had created based on our third disbursing code, I see that I have, I'm sorry, give me 1 second. I know I was working on benzo candles. I want to have that patient come up instead. So we were working on his treatment plan. I know that I assigned him the insurance plan of Walmart, so it's going to pull in all of those benefit information when I create that consult letter. I know that this patient has a $50 deductible that was not met, so I can add that in here. And we called on benefits and we heard that he has already used $500 this year, so I'm going to put that in here as well. And then you'll see that because Walmart is using the Delta Dental fee schedule, and we know that we are a network, the treatment plan is automatically going to try to calculate the write-off as well and add that into the R letter. They'll be able to see all those calculations together. And then again, this is something you can customize. You can customize, add a logo, put more information in the verbiage here. And then this is what our system is actually calculating. So this is the treatment that you're proposing. This is the office fee schedule or UCR. This is the allowed fee schedule from the insurance plan. And then this is what we think that insurance will pay based on the benefits that we have saved in our system. And then this will give the balance of what the patient would owe for their appointment. You'll see here that this asterisk is where our deductible is applying. And then if this patient were to start maxing out on their $1,500 plan, then you would have a cross to indicate where they start maxing out on their plan. And then it just gives a breakdown of the information, like how much it would cost out of pocket, what we think your insurance company may pay, and then what the patient balance is. It just breaks it down for them, as well as inputting the plan information here too. So being able to present this to the patient and calculate this in real time as the patient's sitting with you in your consultation gives them a better idea of what they would be responsible for. So they're not walking away with thinking, oh my gosh, I'm gonna have to pay this much, but it helps alleviate a little of that stress and relief. Being able to present them with a estimate also helps them make a better decision and probably more likely to schedule out rather than having to wait to get information back, verified, then reaching out to them, and then might be a few more weeks and they decide, you know what, something's come up, I'm not able to schedule anymore.
Holly, question that just came in. Are you able to have multiple fee schedules for the same employer if they have multiple plans available for the same employee to choose from?
You could, that would have to be, you'd probably have to build those out based on the insurance plan and then apply different insurance plans to that patient. It's gonna be a little bit of a manual switch under the insurance information.
Got it.
You can
Another,
also, oh, I'm sorry, go ahead.
sorry, I didn't know you were done. Keep going, Holly. Apologies.
Um, no, I apologize. So under insurance, you are able to input two subscribers. So you could do primary and secondary, and that will pull into that letter and calculate as well.
Awesome. Someone else asked, is there a feature to merge duplicate insurance plans or insurance addresses?
At this time, there is not, once our system has something tied to a patient, it's harder to delete that out, that information, because there's probably a claim that has gone out historically with that insurance company tied to it.
Got it. Cool.
All right. Any other questions regarding treatment plans or insurance?
I don't think so. We
All right.
got through a lot.
Okay. Well, the last part I'll talk about, and I'll make it really short, is reporting. The reporting and analytics will help you guide your office be able to pull metrics, KPIs to see what's going on, trends that are happening. And so within DSN, we do have a few areas where you can pull in metrics. Under reporting in cloud, we have a dashboard, and this is going to be per user privilege. So not everybody in your system is going to be able to see this. You can decide who has access to this. Maybe it's just the provider, the office manager, the practice manager, and maybe your insurance coordinator or somebody like that. But there are different widgets that I can create, and I can create as many different dashboards as I want or that I need to see. I would come in here right now. I have appointments rescheduling by types of service. There's one multiple for scheduling. You can see how many new patients versus returning patients are coming into your practice. That might be good for periodontists or general dentists who are seeing what the numbers look like, new patients versus returning. And then you can also pull in production by time period and have that outlined by appointments and then your write-off and net production if you are an in-network provider. And then we also have metrics to track treatment plans, whether or not, how many treatment plans are diagnosed right now, meaning currently they've been created, how many of those treatment plans are scheduled out for surgeries or appointments, and then how many have been completed. In addition to this dashboard, we also have over 200 reports under our reporting modules, even in V20, V30, and then also in DSM Cloud. We have anything from patient demographics to what's our trend with our referrals, what has been going on over the last quarter, year, and then I would also like to see my referrals based on a time period. Back in May, did they have a higher rate of referrals and now it's slumped down in September or October? We also are able to pull reports to a very granular level for AR. We can see how long an account has been aging. We have an extended aging report that goes up to a year. We also have an AR report that breaks down patient versus insurance detail and in which aging buckets that falls. So the reporting is pretty robust. Other practice management software also offer this, and some of them allow you to create user reports to pull metrics and information.
Oh, another person asks, again, are these features available in V30? I think the answer to that, correct me if I'm wrong, Holly, is that yes, they are, but this dashboard is specific to cloud, correct?
Correct. And there are some other reports that have come out for cloud since it's the newest product that's come about. There are some reports that exist in cloud that are not available in V30.
Got it.
That concludes my portion for areas in the software and practice that you can add automation for your workflows.
Yeah. Amazing job, Holly. Are you able to
Great
go
question.
back to the deck quickly? I know we're basically out of time. So there should be, Holly, if you go a slide or two forward, there's a little
Oh,
case study, which just the marketing brain in me put this in there. I don't think we need to necessarily go through this, but super high level. DSN, we help companies save a lot of time on their tasks. One of our customers, we help do that. You can read this here. You can read about it on our website. I know there are just 2 more minutes left. If anyone has final questions, feel free to put them in now. Like I said, I'll be sending this recording out to everyone most likely tomorrow. We'll make it super easy to get in touch with us. You can reply to that email. You can reach out through our website. We'll respond promptly. Any feedback you have too would be awesome. I know throughout this call we've received a lot of feedback. As I said, this is my first webinar. So if you have any comments, concerns, if you want to heap us with praise, feel free to do that as well. We definitely will be doing more of these in the future. And thanks everyone for attending again and for asking some really good questions.
yes. Thank you guys for your time.
And I'm not seeing any more questions, so I think we'll call this a webinar right at 7:29 Eastern. So we'll give, just one more came through. Spoke too soon. Okay, this was more a feedback from someone saying we would love to do more training and shortcuts, but not on cloud. Yes, absolutely. That's something we plan on doing. And yeah, I think that's it from our end. Holly, thank you again. This was awesome.
No,
Oh,
thank you guys. Oh,
I keep speaking too soon. All right, someone asked, someone has feedback about DSN Cloud, which I will take a photo of. Something about adding the payer ID in the insurance tab. That is a feature
okay.
in 30. I will send this. And then someone said, we would love more webinars. Well, lucky for you, we will definitely do more.
Any topics?
Yeah, feel free to send topics. Once again, I'll be in touch with everyone here. I'll send this around. You'll be able to reply directly to that email. Thanks so much, everyone, for attending and for your questions. And we'll be doing more of these soon.
Thank you guys. Have a great evening.
Yep. Bye.
Thanks. Bye.